So today we're going to show you how to do the female insertion. Before we do the technique, let's look at the tray setup. We have gloves which are clean, alcohol. We've already prepared our lidocaine and bicarb. You should have either 6 or 7 cc's of lidocaine with epinephrine and 1 cc of sodium bicarb. You have a sterile knife, you have your Steri-Strip for later, and a sterile setup with a female trocar, and we'll show you how to use that later. It is really important later that this whole set stays together when you clean and autoclave it. Before we start the actual insertion, I want to show you how to position the patient because it's really one of the most important things. We're going to use the pellets in the right hip today so the patient's laying on her left side. Most of the time the patient will actually bend her top leg and straighten her bottom leg because that's the way she really sleeps, but that's not the proper technique. We like the bottom leg to be actually bent and the top leg straight. Once that's occurred, she's in the right position for the insertion. As we continue the female insertion technique, I'd like to introduce Mandy Donovitz Cotton, nurse practitioner. She'll actually be doing our insertion today. The patient's properly draped and the patient's properly in position. So beginning the procedure, we like to know where are we going to put the pellets. So Mandy's going to put some gloves on. She's going to identify that soft spot in the glute that she wants to have the pellets land in. And once she decides where the pellets should land, and then she's got that landmark, she's going to go about 3 finger breadths lateral to the top of the crease. That's where she's going to make her incision. And she'll make a little mark with her fingernail or whatever, and that way she knows exactly where to put her wheel, and she'll know where to put her incision. So now we know where the pellets are going. She's going to get some alcohol, and she's actually going to create an area with the alcohol, sort of in a round baseball fashion, in a circular fashion, starting where the incision is going to go and extending laterally. Once that's done, she'll take her lidocaine, and again, this is 6 cc's of lidocaine with 1 cc of bicarb, or 7 cc's of lidocaine with 1 cc of bicarb, and she's got a 22 or a 23 gauge needle. The most important thing is the wheel. She'll go to the place where the wheel should go, and she'll make a small nick with the top of the needle, creating a wheel about the size of a dime. Then she'll be injecting right towards the area where she wants her pellets to go, constantly injecting, leaving about 1 or 2 cc's for that last injection as she drives the hub of the needle. You must drive the hub of the needle in order to get the lidocaine past the tip of your trocar. Now what she needs to do is build her trocar while the lidocaine is setting up. You have a trocar and you have a sharp plunger that will go inside. These trocars are married for life. So if you'll keep them together, they'll always fit. If you mix them all up, they're not going to fit. Once she's built her trocar, she'll get her 11 blade and a little gauze, and she'd like to make a nick. The nick actually goes up and down. That heals the best. So a small incision, 1 time down and out. That's all she needs. Just 1 nick with the blade, and she's done. Now she'll get her trocar, and what we call burying the bevel. She'll take the bevel in the same direction that her incision was in. She'll go in, bury that angled portion of the bevel, and then lay her trocar back at 30 degrees to the skin. Once the trocar is laid back at 30 degrees to the skin, she'll begin a twisting motion. That twisting motion is actually what allows the trocar to go through the fat easily. And so she'll continue to twist until she gets to the hub, removing the sharp portion. She'll also have the basket, which is the area where the pellets are going to go at the 12 o'clock position. Using her forceps, she'll pick up the pellets. Always start with the smallest pellets first. That's going to be the estrogen if you have estrogen and testosterone, or it could be the smallest testosterone pellet. Place it in the basket, followed by the larger pellets sequentially. Once all the pellets in the female, they all load at the same time, are in the basket, then she can put her medicine cup down and she can get the blunt trocar. The blunt trocar is actually what's going to push the pellets into the subcutaneous tissue. With 1 motion, stabilizing the trocar so that it doesn't push back with 1 hand and actually pushing with her thumb with the other hand, she can deliver all of the pellets at 1 time. Rather than pull the plunger out, she takes everything out at 1 time. Now, all she has to do is close the incision and we'll be done. So she'll take some benzoin and she'll make a stripe on each side of her incision. And once she's done that, she'll be able to steri-strip that incision, and then we'll be in good shape. That incision should then be closed. You really don't need to stitch these incisions. You don't need Dermabond. You can use all that, but it's really unnecessary. So benzoin followed by steri-strip, pulling the edges together. We'll take another piece of gauze, fold it into fours, and we will cover the incision with the gauze. And then we will take a piece of tape, crossing the steri-strip, not in the same direction, but crossing it. That'll make it easier for the patient to take off that tape tomorrow. We then like to put pressure on top of the gauze so that we can show the patient this is where your incision is, and the gauze and the tape on top will come off tomorrow. You'll then leave the steri-strip on for 3 days. No hot tubs, no hot baths, no soaking in the swimming pool, no elliptical, no biking, no squats, nothing that works the glutes. Otherwise, you increase your chance for the pellets to come out. If we do that for 3 days, everything should be great, and we can then take the steri-strip off. And this concludes the female insertion technique.